Hi, this is Miss Amanda, and I'm going to be going over a few skills for Mod 1. Today we're going to be doing personal hygiene, bed bath, and I'm also going to be going over head to toe assessment with you, just because they can correlate and be done at the same exact time. So if we are partnering up with a CNA or another nurse for moving, lifting, whatever, but all of them can be done in morning routine, so this way you get your day started off at a good pace. Okay, so the material that we would have to put for a bed bath, because we're going to want to change the sheets as well. So first you have a basin full of hot soapy water, a couple of face cloths. You also have some Sani wipes. These also come in antibacterial wipes. You can see them through. You tear, throughout facilities, you tear them in the back. The red wipes are heated, and they actually have directions as for each wipe where to go to do a full bed bath with them. So if you see them in your facility, you can utilize them. If not, nothing's better than a hot soapy water. Then we have a dry cloth and a bath towel. When we're going to change the sheets, we will have our fitted sheet and our folded sheet, plus our quilt and our chucks pad. This is different types of bedpan. This is for a fractured hip. This is your normal style bedpan, and then this would be a collection for the a hat for the bathroom. Okay. If we're doing personal hygiene, some other things that you want to bring in, if the patient has dentures, we'll bring in a denture cup. Shaving. We can do nail care. So we have some nail files, manicure picks. Okay. We also have combs. There's some shaving cream in here. Not every patient is going to be able to do all of this, so you pick patient specific, okay? And then we have our denture care, denture cups with dentures in them, and then this is a kidney bean bowl to be able to soak, or if the patient has the ability to brush their own teeth, you can have them spit in here, okay? Also, if they're not feeling well, you can give them this, but usually if they're not feeling well, I give them this. Then we have toothbrush, toothpaste for either their own teeth or to help with dentures. And then this is a mouth swab. This one is actually flavored mouth swab. This would be for a patient who maybe is NPO, just to freshen up their mouth without the use of all of that water, so that they don't aspirate, okay? And then we also have TED stockings. If the patient is ordered for TED stockings, that's something that you can remove and put on a new pair after you've gotten them all washed up and assessed their feet and legs for no abrasions, breakdowns, skin impairment. So we are going to incorporate a head to toe assessment, so I'm going to just show you how to do it as I would be approaching any normal patient. Okay, so first you're going to come in, you're going to introduce yourself. Hello sir, my name is Amanda Madison. I'm going to be your nurse for today. How are you feeling? Good. Are you having any pain? No? This is a great first thing to ask, especially when you have all of this planned for the patient, because if they say, yes, I'm having a lot of pain, moving them and doing their oral care, mouth care, full bed bath change, that might not be the perfect timing for that. So maybe go get some PRN pain meds and come back once they've hit in, and then start your day. So it's always going to be patient-centered care that you want to focus on. So you're not having any pain today? That's fantastic. So what we're going to do, what I have planned today is bed bath. We're going to change the sheets, maybe do some mouth care, and if you have to go to the bathroom, I can help you on the bedpan. Does that sound okay? Great. If they say, listen, my wife is coming, can we do this after? Can I do it after breakfast? Maybe my wife is coming, I would like to do it now. That's really important. Again, patient-centered care. Okay, so to start the head to toe assessment, I'm going to be looking at the patient's hair and seeing for any bumps, any redness, especially underneath where they hit the pillow, any problems here with skin. If they have oxygen, it also goes around the back, nasal cannula of the ears. So I want to look at the back of the ears, make sure that their skin isn't impaired. Okay, then I say, all right, so I'm going to look at your ears. You pull the peanut up and back for adults, and you look inside their ear, and you do the same. Okay, now we're going to do a test for your eyes. I'm going to have you close this eye and cover it up. And we're just checking for light reflection. We close up the eye because we don't want the other eye to be reacting and then we don't see a reaction. Okay, so we looked at there and we can continue to check. I'm going to hold out my pen. Can you just follow it? Don't move your head. We're going to go up. Very good, and accommodation. Fantastic. Okay, and then we're going to check the nose. Any redness, dryness, bleeding, cracking in here, especially if they're on oxygen. I'm going to have them take a sniff in and out, in and out. Fantastic. Any problems with your nose? Do you have any drainage or postnasal drip? No? Fantastic. Then if we're going to use the pen light, we're going to also look in their mouth. And we're going to look around. If they have dentures, we take them out. We check the surrounding skin, making sure that it is fitting appropriately, that they don't have any underlying cuts or cracks inside their mouth, because if bacteria or infection get in there, we could very easily have a systemic infection. So we ask them to open their mouth, stick out their tongue, say ah. We get to look at the lips, any cracks there, nothing. And then we're done with our pen light, okay? So we say, how are you feeling with your neck? Any problems swallowing? And we're palpating the lymph nodes. Can you swallow for me? Great. Okay, and we're checking the swallow. This is also good about gag reflex. Can they manage their own secretion? We're checking for skin turgor here, right at the clavicle spot. Okay, so we check for skin turgor to see for hydration. Okay. And we've already checked their lymph nodes here. Okay, and then we can say, all right, gonna take a quick listen to you. Any shortness of breath or chest pain? No? Okay. So when we check the heart, we're going to have them breathe normal. And we're going to do a J around the heart. We're gonna make a J right here and encircle the heart. So the heart is on the left side of the chest. So you don't want to be listening over here unless you're doing lung sounds. So these are heart sounds. So it's all physicians enjoy Time magazine. Okay, or all people enjoy Time magazine. Okay. So all is aortic. This is the second intercostal space. Okay, so that's the aortic. Straight across, second intercostal space is pulmonic. Third intercostal space is Erb's point. Fourth intercostal space is the mitral valve. And then fifth intercostal space, mid-clavicular line, so right at the nipple line, is going to be your apical pulse, your mitral valve. Oh, I apologize, this was tricuspid and mitral. So aortic, pulmonic, Erb's, tricuspid, and mitral or apical pulse. Okay, so 2, 2, 3, 4, 5. All physicians enjoy Time magazine. Okay. And these are the valves of the heart as they open and close. If they have a murmur, you're going to hear it in that perspective. If we're going to take an apical pulse, we listen for 1 whole minute. Okay, so those are heart sounds. Okay, so while I'm doing the heart sounds, I can be looking at the skin and seeing how the patient skin is doing. If it's a woman, we can even give her a little bit of discretion, maybe place my stethoscope to listen and then cover her up, okay, for discretion. All right, if you have a hard time hearing, you can have the patient lean over to their left. It brings the heart more superficial to the skin, and then you'll be able to hear better, okay? So once we listen to that, then we can say, take a few deep breaths for me. And as they take a few deep breaths, we can listen to the lobes of the lungs. And then we go back for the base of the lungs. Okay, so that can be the front assessment of lungs and the heart, okay? So while we're also here, we have brachial pulse. So I can feel the brachial pulse, make sure that they have that. Then what I'm going to do is I'm going to start my head to toe bath, okay? So I bring in my bath supplies, and I would have everything in the room anyway. So then I would say, okay, so as I'm doing this, why don't we start washing up your face, right? So the first washcloth is going to be for the patient's face. Want to wipe out away from the eyes. Okay. If they're independent, by all means, let them do this by themselves. Okay. And then you can do their chest. Okay. And I can do my head to toe assessment there. And their stomach. Okay. And then that is, usually I'll put that on the floor, but then that's wasted. Okay, so one is for just the face and upper chest. Then we can listen to our bowel sounds. So first we want to inspect. We see, doesn't look like there's any kind of raised areas or anything. We don't want to touch. We inspect, auscultate, palpate in that order, okay? So we're going to listen. Each quadrant, right lower, right upper, left lower. And if we don't hear something, we listen for 5 minutes. And we ask the patient, any problems here, any pain? How are you eating and drinking? Good. Any nausea, vomiting, diarrhea? No. Have you been going to the bathroom okay? Good, very good. And then when we come further down the arm, we can check a radial pulse. Okay, so we want to always do a radial pulse with the palm down. Very good. Here is where we can also come around the side. And we can check, so radial pulse here, right at the thumb line. We can also check capillary refills. We can check the skin of the patient, make sure that that's okay. All right, so now we've done all of that, and we can be checking range of motion the whole time. Like I said, if the patient's independent, are they independent of their upper? Can they do their own face and upper? Maybe I can just set them up and they can do their whole upper body, and I can help them with their lower, okay? So now when we get to the peri area, again, this is going to be another washcloth. So you should have about 3 or 4 washcloths. First washcloth can do the whole upper. Second is going to do the lower. And we're going to check the genital area, especially again with discretion. How are you going to the bathroom? Eating and drinking okay? Are you urinating? Good. Any pain with urination? No. Okay. And we're wiping down. Obviously open the legs, right down, and then we're discarding this, okay? All right, checking for any problems here as we ask the patient if there's any problems with frequent urination, nighttime urination. When was the last time you went to the bathroom? What did it look like? What color? Was there an odor to it? How do you get up and walk to the bathroom? Do you have to use a walker, a cane? Do you have one of those at home? If he's been using a bedside commode, then does he have a plan to work with PT to get to the bathroom, or do we need to order him a commode at home? Okay, so remember, everything that they're doing here might have to translate to home. So we have to be cognizant of that, and maybe talk to the case manager, social worker, about, hey, he's been using a walker, he doesn't have one at home, can we order him a walker or material as he starts to get closer to discharge? All right, so we've done our peri area, we've asked him, how is you going to the bathroom? What about bowel movements? Have you had any bowel movements? Be careful with saying, are they normal? Because the patient will say, yeah, it's my usual, but maybe their usual is diarrhea every day and they haven't formed a stool in a really long time, okay? So, have you gone to the bathroom? When was the last time you went to the bathroom? Okay, what did the stool look like? Was it formed or was it loose? Okay, was it liquid? What color is it? Okay, try not to have leading questions like, was it black? No, what color was it? If it was black, do you take iron supplements? Because iron can change the color. So you've been eating, drinking okay, going to the bathroom. You have had bowel movements. So we wouldn't document okay. Patient has normal lung sounds. Lung sounds are clear. He has S1, S2 for heart sounds. No murmurs, rubs. Bowel sounds are active and present in all 4 quadrants. Palpated, smooth, soft, abdominal. Patient urinating appropriately, clear yellow urine. No foul odors, no pain with urination. Patient having normal bowel movements for himself. Usual schedule is every 2 to 3 days. Patient last bowel movement yesterday of formed brown stool. Okay, so it's not just everything's okay, right? That's how we say in nursing, everything's okay. Then we're going to move down to the patient. Again, maintaining discretion. Pull up the sheets. Okay. And we can finish with their legs. So, if you run out of face cloths, and it's very common that you will in a facility, you can take a bath towel and kind of break it up into sections, okay? And we're dipping it in, we're doing the feet and the legs, and we use this. This is used, make sure we don't contaminate our water. Take this, do another section. And we can take this, dip it in, do another section. And same with your last. This way, nothing has gotten contaminated, but we're being resourceful if we don't have the supplies we need, okay? If we do have the supplies we need, then we would then take this and make sure we're keeping the skin nice and dry. When we are assessing this area of the skin, of the body, we have our femoral pulse inside. We have our popliteal pulses underneath the knees, okay? Then we also have our pedal pulses, okay? We have, just move the bed up a little bit. We have pulses up here. This is dorsalis pedis and posterior tibialis. Posterior tibialis, you'll have the ankle bone right here. It's right behind the ankle bone. And then you're going to have bone right here at the top of the foot, right at the arch of the foot, and it'll be right on top of there where you can palpate it, okay? It's good to stand at the end of the bed like this because we can visualize the patient linearly, and we can also check both legs because we want to compare both legs, DVT, swelling, warmth, anything like that. Okay, so as long as the calves look good, no edema, no swelling. Here we can do capillary refill. We can also peel apart the feet, make sure that there's no breakdown, especially if the patient is diabetic, checking the heels. Range of motion here too. Can the patient help you or are you doing everything? Okay, then we can check over here, make sure everything's good and clean, right? We've cleaned this area. If there's any dressings, the patient has a dressing here, so I would take this dressing down, note the exudate, the drainage over here, and then we would do a new dressing, okay? Because look, this is already, the integrity of this dressing has been lost, so we would have to redo this dressing, okay? So then what we can do, so we've finished that. These are all dirty linens, we're going to fix that. Now what we're gonna say is, we're gonna turn you on your side, sir, and we're gonna clean off the back of you, give you a nice massage with some cream, if that's okay. So what you would do, side rails up. This would be very good to have another partner, unless the patient is completely independent with you. But we would put our side rails up, like we said, put the patient on his side, right? This would be a perfect time to take a face cloth from your new basin and we can wash the peri area, make sure everything's okay. Now, this is a perfect time to be able to assess the whole skin of the area, the patient's range of motion, how supportive are they being done? Is it 1, 2 max assist, or is he independent and holding onto the side rail by himself, okay? Also, this is a perfect time put your stethoscope on and listen. Okay, so I'm gonna take a listen to your lungs. Can you take a few deep breaths for me? Great job. Now, you have scapula, spinal column. You want to try to stay along the spinal column, because if you are over the bony prominence, you're not gonna hear air movement. And you also wanna move left to right, comparing the two sides, okay? If the patient now wants to take a deep breath, they're going to take a deep breath, I apologize. But if they need to take a cough, this is a perfect time. Turn, cough, deep breathing. This is the perfect time to do a cough. It's okay, good for you. Get it out if you need to, because they're also gonna expectorate out. If you know the patient's gonna cough when you turn them, you can give them their kidney bean bowl that they could spit it out if something comes up, okay? And then like we said, we can assess coccyx for any kind of redness, okay? So this is a perfect way to finish your head to toe assessment. Yes, and then if the patient isn't getting up, going to the bathroom, this is also a great time. This is also a great time to introduce the bedpan. So if we're not doing a commode, we can do a fractured pan or a regular pan. These are for our hip patients. So you would do the same thing, okay? All right, so we're gonna put you on the bedpan for a little bit, give you some privacy. Okay, we're gonna turn the patient over, and we would put them on the bedpan. Okay, you need to make sure that it's lined up. Some people even like measure it, and then just have them roll over. Now, obviously you see that his hips are up. If the patient can tolerate it, that they can spread their knees and help their hips onto it. And then what we would do is take the head of the bed up and let the patient be sitting, okay? Because you want to try to reenact the most normal way to have a bowel movement, okay? Then you give the patient some privacy, some time on the bedpan. This is a perfect time to maybe go wash out your basin, get a new thing, so this way you can re-clean their peri area. Okay, so you can be behind the curtain, cleaning up your laundry, picking up things off the floor, putting it in your laundry basket. You can get them new Johnnies. Okay, can take all this stuff out, get a new nice soap and water, new cloths if you need it, right? Okay, so now the patient's all done. Yep, now the patient's all done. We're gonna show you how to change the bed sheets, okay? So I've grabbed everything I need, given the patient some time. Say, how you doing in there? Oh, you feeling okay? Ready to come off the bedpan? Maybe gave them the call light and they pressed their call light now that they're ready. All right, so we're gonna get you off these sheets and into some new clothes. Okay, I'll put myself over there on the working side. Be careful over here, so with the linens and stuff, you wanna make sure that you're not putting them on the floor so you don't slip, okay? So we're gonna have you turn over. I'm gonna get you off the bedpan. Again, if you need help, you get help, or if the patient's independent, you're more than welcome to have them maybe hold on to the side rail right here and turn over. Good job. I always giving them encouragement. And we're wiping them. We're assessing what this looks like, maybe putting it off to the side, and we can go drain it after the patient is done, okay? So keep this here just in case you need to wipe up the patient or something isn't done, just so this way you're not dirtying the linens if you're not ready to change the whole bed. Okay, so we take this off and we put it on the floor. We've cleaned the patient, okay? Now what we're going to do, we're going to say, how are you doing on your side there, okay? Again, you could want some help with this, but sometimes help doesn't come. So what you're going to do is you take your old lot for one person, so if you need help, asking for help is awesome. So what you're gonna do here, you can even have the patient come down. You fold in the new one. Okay, and you would set up your bed. Just as you would making it, right? Fold in this. And some of you might be med techs or CNAs already, so you've got this down pat. So we're gonna leave these guys for the end. But what you would do is get here. What you do is you put it to the edge of the bed. You want to line it up to the patient's hips, and then you roll it. And you take your new sheet and you roll that in. Again, making sure it's up to the patient's hips. Okay? And you get everything ready so that the patient turns as little as possible, because you don't want them to have, okay, turn one more time, one more time, one more time. Patient gets tired, okay? So what you're gonna say, okay, we're gonna turn you, you're gonna feel a big bump. You're gonna keep turning, and then we're gonna get you off that bump, okay? And what you do is you push this in, the old, push it in, and push the new stuff underneath the patient. But make sure that you have enough, okay? You're gonna come over a bump, very good, very good. And now what you're gonna do, you can be on the other side or have somebody help you. Okay, and I'm gonna have you roll over again. Great job, hold onto the side rail, perfect. And then what you can do is maybe you have to get this side of the patient if you have to clean anything more up. If not, you just unroll. So this would be an occupied bed change. Make sure that's all set. And then you can take off all of these. This would be, now the nice part of that is that all of the soiled stuff is inside, and the stuff that was touching the mattress is now on the outside. So this way there's less contamination for you. We get the feet. And then we go like this, make sure it's nice. Sometimes you might want to put the the Johnny, so that it's not pulling him or her to be loose. Okay, if we're changing the Johnny, we can change the Johnny now. Then again, we change the sheets. And we'll get you a nice clean sheet for you. Make sure we have good proper alignment. This is also when we could boost the patient in bed if he or she needs it. Maybe they've slid down. If they do need to be boosted in bed, you would have them hold their arms up, then you would roll this here, making sure that your pad is right with the hips, and we would boost. We can do reverse Trendelenburg, okay? Then we put a nice clean sheet on the patient. Sheet to go over their face or onto the floor, so you gotta keep control of it. There we go. Okay. Just to measure it out. And then we do nice clean hospital corners. Obviously your bed should be locked at all times. This is just for instructional purposes. When we're doing military corners, you want to put the sheet and the quilt over the edge of the bed. do, so everything's nice and clean with the patient. They have enough room to pull it up if they wanted to. All right. Then what we're going to do is a military corner. All right. You're going to down. So it's all tucked in, even. And then you're going to see this flap here, okay? So you've tucked it in all the way in. You'll see that flap. Now you're taking that flap and tucking it in. Nice strong corner. Okay? And you take that flap and you tuck it in on this side. Okay? This should be a nice hospital corner, and that's pretty much all you're going to do for tucking in, because you want the patient to be able to move. And we say, okay, looks like we got everything for you. Take all of our linens, put them in our linen cart. All right, so we have our linen cart over here. We'll go all the way over here. You should probably bring it to your room. Put our linens in our linen cart. Okay. Clean up our area. We wash our hands, right? Now, if we're doing denture care at a sink, we would take our dentures. If they have the denture tablets that you can be soaking this the whole entire bed bath, and then take it out, run it under nice water, and brush their teeth. Again, rinse it, brushing in the crevices, making sure everything's nice and clean, okay? If they need it for now breakfast, this is a perfect time to do it before breakfast, before their pills, their morning medication. This way they're up, they're refreshed for the day, they're ready to see their doctors. These questions that we've been asking them, oh, actually I do have a hard time going to the bathroom, I do have this, I do have that. Now I, as the nurse, have questions to give to the patient, give to the doctor during rounds. Hey, you know, this morning he was saying that he has been having a hard time going to the bathroom. It's been 3 or 4 days, okay? Okay, so we have all of that. Put that away. Now, we have put the bed in lowest position, side rails up, making sure that we don't have any crevices or creases in our sheets, because that can cause skin breakdown. And then we say, okay, so I'm all done on my end. Is there anything else that I can get you or that you need before I go? No? Okay, so when the doctors come in, I have your medication for you. We're gonna take that, but when the doctors come in, don't forget to ask them about how you said you hadn't gone to the bathroom, but I'll keep on top of that too. Hopefully today we can get you going to the bathroom. Or if they didn't like breakfast, or they're having a hard time with lunch, maybe we can get the dietitian to change up their meals for the day. And now we have the plan of the day, okay? So that is head to toe assessment, bed bath, changing an occupied bed, oral care, hygiene, and bedpans.